This video demonstrated a simple 10-minute procedure to effective cervical selective nerve root block under ultrasonic guidance. In this instance, the injection was targeted into the left C6 nerve root. This outpatient procedure was done without specific patient preparation. The patient was placed lying down his right side. The head and the neck were set on a hard towel, and the neck was bent slightly to the right side. Standing behind the patient, the surgeon set an alcohol-wiped ultrasound probe perpendicular to the neck. Then the surgeon determined the location of the trajectory to the left C6 nerve root target. The surgeon obtained an image of the left common carotid artery shown surrounded by red dot. Then the surgeon moved the probe a little posteriorly. Anterior and posterior tubercle shown outlined by white dot are readily visualized, but the level C5 or C6 needs to be determined. A nerve root shown surrounded by yellow dot was visualized going through the tubercle. The surgeon continued to determine if the level was C5 or C6. To do so, the surgeon moves the probe slightly to the caudal side. The next lower nerve root was a posterior tubercle was seen, but not anterior tubercle. This observation meant that the C7 vertebral level had been identified. The surgeon changed ultrasound setting to power Doppler mode to visualize the left vertebral artery at the C7 vertebral level, another landmark. The pulsating blue signal shows the left vertebral artery. Then the ultrasound setting was returned to the normal mode because the power Doppler mode worsened image resolution. The surgeon located the presence of a C7 nerve root shown surrounded by yellow dots and between the vertebral artery and the C7 posterior tubercle. The probe was moved to the cranial side and located the C6 target nerve root, shown surrounded by yellow dot, in between the anterior and posterior tubercle of the C6 vertebral level, shown outlined white dot. On locating the target nerve root, the surgeon must determine if the blood vessel is abnormally situated around it, with the ultrasound again set in power Doppler mode as to avoid an intravascular injection. The skin was sterilized under the ultrasound guidance. The surgeon gently inserted the 70mm 22-gauge needle towards the nerve root located inside of the posterior tubercle. When the tip of the needle slightly struck the target nerve root, the surgeon verified that the patient felt radiating pain at the affected area. After confirming that the blood or cerebrospinal fluid had not aspirated into the syringe, the surgeon slowly injected lidocaine and steroid. Finally, the needle was removed and the right pressure was applied to the injection site for 2 minutes. The entire procedure took about 10 minutes. Patient remained for 30 minutes for bed rest.